Good afternoon. My name is Howard Tipton. I serve as the County Administrator for St. Lucie County. This is the March 27th briefing for our community. We are coming to you as part of our Emergency Operations Center. We are at a level 2 activation, which means that we have activated certain emergency support functions as well as the command and general staff. The state of Florida is at emergency operation level 1. Current status as of 12/15 today, 47 out of 67 counties in Florida had active cases of COVID-19. More than 31,000 people in the state have been tested. There are 2,900 confirmed cases. 28,525 people have tested negative. Across the state, 456 people have been hospitalized and 34 fatalities. St. Lucie County has 14 confirmed cases. In our surrounding counties, Martin County has 16 cases, Indian River has 14 cases, Okeechobee has none reported. St. Lucie County continues to monitor the situation in coordination with the state, the health department, and our medical providers, fire rescue, law enforcement, and our municipal partners. At this time, there are no additional protective measures to report. One operational change is that the tax collector's office will now be open Monday through Thursday. I would like to, at this point, because this afternoon's briefing is really going to focus on the medical side, which is what I think most everybody wants to talk about. And so I'm going to bring up next Clint Sperber, who's the administrator for the St. Lucie County Department of Health. Clint.
Thank you, Howard. Again, Clint Sperber, Health Officer, St. Lucie County. St. Lucie County today is reporting its first death associated with COVID-19. Our sympathies go out to his friends and family. As Howard mentioned, we do have 14 cases in the county that have been reported here. 12 are residents who live here, 2 are residents outside of the state. With the 12, we are in daily communication with them, and what our main goal is, what we really need to do to stop the spread from a health department standpoint, is our contact tracing. So when we learn about the cases, we follow up with them immediately and learn more about who they have been in contact with. Based upon that, we quarantine, we provide isolation recommendations along with self-monitoring, and those will be the best ways to contain the spread of the virus. Our health department staff are also in daily communication with long-term care facilities, dialysis centers, and the hospitals. We are working with the hospitals and the Emergency Operations Center to identify strategies to help hospitals manage COVID patients if the need arises. Testing capabilities have been ramped up by the federal government and the state government to focus on where community transmission is taking place. We still encourage residents to keep using prevention measures and monitor yourself for symptoms. If you become sick, call your healthcare provider for evaluation to rule out other illness and stay home. You will hear shortly from our hospitals, and though I'm sure reinforce that message. Prevention is critical, and everyone has a responsibility to prevent the spread of disease. The best way to protect yourself is to practice good hygiene and the social distancing recommendations we have spoken about, especially for adults 65 and older and those with underlying medical conditions like heart disease, lung disease, because they are more susceptible to developing serious injury and illness. These measures are in place because there currently is no medicine to treat patients and no vaccine to prevent the spread of the virus. Thank you. Next, we'll have Rob Lord from Cleveland Clinic.
Good afternoon. First, I would like to address our readiness and the actions we've taken. Cleveland Clinic physicians and leaders have been holding regular multidisciplinary meetings for a little more than 2 months now. We've been working to manage our supplies during that time, making sure we have resources to protect patients and caregivers, not only today, but into the future. We currently have adequate supplies, but that's a day-to-day measurement. A lot depends on what happens as we go through the future and our community's compliance with social distancing and good hand hygiene. We must continue to conserve these resources for this potential surge of patients that I'm sure we're all hearing about. Cleveland Clinic Florida is closely collaborating with our public health officials, both on a local, state, and national level. We've developed plans for a number of contingencies, knowing full well that those plans need to be flexible and adaptive under this very uncertain virus, and a course that we are not clear on what course it is going to take. We are working with our county emergency management folks and the Department of Health on options for setting up alternative care sites. And we've taken a number of other steps that can help minimize exposure of our patients and our caregivers. As I hope most of the community is aware, we did start drive-through testing in both Martin and St. Lucie County. That began on March 14th at Martin North and then moved to Tradition Hospital in Port St. Lucie and Indian River Hospital in Vero Beach. In that time, we've tested about 800 people in those 3 locations. First, the patients need to call a nurse triage line that help determine if they meet criteria determined by the CDC and the Florida Department of Health. If a person meets that criteria, they will get an appointment for a drive-through location. They won't even need to get out of their car. As of March 25, we've screened more than 5,500 phone calls and tested nearly 1,000 people. Through this process, we've kept people who have COVID-19 symptoms out of the emergency department, physician offices, and without exposing them to others. So we think that that is a good course for us to take and for members of the community to take. We've also moved strongly in the direction of what we'll call virtual health. Cleveland Clinic Florida region is developing processes for patients to contact their providers using phone calls or video visits. This also reduces risk for the patients and the providers. Cleveland Clinic's virtual visit program, Express Care Online, can connect individuals with a physician by phone or computer, and we have eliminated the fee associated with this to any person who calls during this COVID-19 crisis. Cleveland Clinic has also established a hotline to answer patients' questions regarding COVID-19. That hotline number is open 24 hours a day, 7 days a week. The number is 855-697-3750. Earlier this week, we also postponed all non-emergency and non-essential procedures. We want to be clear with the community. Surgical cases that need to be done on an emergent or urgent basis are still being performed. These include cancer surgeries and cancer evaluations, surgeries for infected joints, and other indications consistent with the Department of Health guidelines. If a patient determines a procedure cannot be postponed or their doctor, it can be performed. This allows us to create capacity in both our hospitals and to conserve the personal protective equipment that is so scarce at this point. And we're also trying to minimize, again, exposure to other patients and caregivers. If you visit one of our facilities, your temperature will be taken before you enter the facility. We've also put very restrictive visitation rules in place. Understand that that is for the protection of the visitors, the patients, and the caregivers. Anyone who has a temperature of 100.4 or higher will not be allowed to enter the building. In closing, this is a unique situation and a rapidly changing situation. We've been preparing for this and managing this situation for months. We are fortunate at Martin Health to have a seasoned group of emergency managers helping lead us through this process, and we're fortunate in our communities to have very skilled people working with the Department of Health. Across Cleveland Clinic Florida and the Cleveland Clinic Enterprise, there are industry experts in emergency planning and supply chain management, and we've been utilizing those resources. We know that it will test the capabilities of our healthcare system here locally as we move forward and also across the state. But we are fortunate. I cannot emphasize to this community, about a year ago we merged with the Cleveland Clinic. We are in much better shape than we would have been if we had been a standalone independent hospital. And as we've been tested before, we will survive this test, we will do well. I've stood in the eye of 4 hurricanes here, 3 of them in my capacity in this hospital. After the 2004 hurricanes, Francis and Jean hit, our North Hospital in Stewart was severely damaged. And we could not access patient beds in our North Tower. And we managed then through the help of our local, state, and community partners. I know that we will do the same as we go through here, and we'll adapt to the situation. I have every confidence that we will be successful as we deal with this. But again, I would want to emphasize to every member of this community, please comply with social distancing. please engage in good hand hygiene. That will protect us and it will protect you. Thank you very much.
We're also fortunate to have the CEO of Lawnwood Hospital, Eric Goldman.
Good afternoon. I want to thank you for the opportunity to come here and be able to give this address. Really, when I think about the state of where we're at and what we need to do, it's a very different situation than typically we see in the healthcare industry. Because oftentimes in the United States, we're talking about public health, or we're talking about private health care and how we deliver private health to each individual. But what this really is a public health emergency today. And if I can impress one thing upon everybody here, it is to please comply with the social distancing. Please comply with all of the county and state rules as it relates to this event, because all of these rules are not designed to help each individual avoid getting this virus. It is really about one thing, and it's about making sure that our hospitals, our healthcare providers, our firefighters do not become so overwhelmed from this disease that we cannot adequately care for the people in this community. I believe we're all up to that challenge, and at Lawnwood Regional Medical Center, being a part of HCA, the nation's largest healthcare system, we are incredibly ready for this event. We have activated our emergency response teams at both the national and local level about 2 months ago. We've been working diligently night and day to secure the resources to be able to care for patients in the safest possible manner, and also to be able to protect the caregivers, to be able to give them the appropriate time to be able to rest so that they don't become ill and all of a sudden we have a situation where we can't appropriately care for patients. We've been diligently watching this situation as it's expanded not just across the world but across the United States. HCA, having over 180 hospitals nationally, has hospitals in California, in New Orleans, many of the places that are seeing, in Miami, that are seeing huge amounts of patients and sometimes overwhelming hospitals. And so we are making plans, learning from their experiencing, leveraging our resources nationally to ensure that this community is adequately prepared for what we see. Hopefully, we're able to stem that tide, slow that down. We will see in the upcoming weeks, not days, weeks, that if we are successful in doing so, but I believe that we're up to the challenge. Our staff has been well drilled. We've been working with our physicians, communicating almost hourly with our staff to make sure that we've got the latest feedback and that we're prepared to handle anything that comes forward. I think it's important to note right now, if you feel that you may have COVID-19, right now the hospitals are really places to go if you feel so ill that you feel that you need to be hospitalized. Your primary care provider should really be your first point of contact should you begin to feel ill and think that you may potentially have the disease. But then at the point in time where you feel like hospitalization may be an option, that's the time to come into the emergency room. We do not want to be able to overwhelm our services with outpatients coming in when we really need to focus on those patients that need and deserve our greatest attention. That being said, Lawnwood St. Lucie Medical Center here in St. Lucie County, we're up to the challenge. We're excited about making sure that we can continue to partner with the county, fire rescue, and really everybody to ensure that no matter what is thrown our way, we have the ability to be able to take care of you in a safe and efficient manner. Thank you.
Thank you, Eric, and thank you, Rob. I do think one of the things that our community has really benefited from is the national affiliation that both of our largest hospitals have, and we're fortunate for that. The other thing I would ask both of you to take back is to your caregivers, please let them know our deepest appreciation for all of the work that they're doing on behalf of our community. Next, I'd like to invite the Sheriff of St. Lucie County, Ken Mascara, up to share a few words.
Thank you, Howard. You must have looked at my notes because the first thing I was going to do was say thank you to not only the medical personnel in our community, but also our first responders who are doing a phenomenal job. I also want to thank our residents and the many business owners in the community that have been impacted by this crisis. We continue to see very responsible decisions being made and encourage you to continue heeding the precautions that have been shared by these medical professionals. With that being said, we're moving into a beautiful weekend here on the Treasure Coast. While beaches are closed, boat ramps are not, at least not yet. Please be responsible this weekend. Do not congregate along waterways or on spoil islands. If you're going out on your boat, do just that. Enjoy the fishing, enjoy boating, but please do not congregate in large groups. Also yesterday, the county administrator closed all arcades in St. Lucie County. My message to these businesses is to please take this seriously. And I do not want to speak for the county administrator, but this closing came as a result of many irresponsible arcade owners allowing many, many people to congregate in their businesses. Please help by doing your part in stopping the spread of this virus. The men and women of the St. Lucie County Sheriff's Office continue to respond to calls for service and are working well with those they come in contact with by practicing CDC recommendations for safe interactions. Deputies continue to patrol neighborhoods, respond to calls for service, investigate crimes, and ensure your safety. This weekend, they will have the added responsibility of checking boat ramps as well as beaches to make sure that the social distancing recommendations are heeded. We live in paradise this weekend. Please spend your time, enjoy it either at home or your backyard, and hopefully our efforts together will slow the spread of COVID-19 in our community, and we can all get back to normal. Thank you.
Thank you, Sheriff. I'd like to invite up now Nate Sparrow, who's the Fire Chief for the St. Lucie County Fire District. Chief.
Thank you, Mr. Tipton. The fire district employs about 100 firefighters each day. We have seen no appreciable increase in sick calls, so that's a positive. We're working very diligently to ensure that our workforce remains healthy and on the job. The New York City Fire Department right now is seeing about a 10% of their workforce being held back for flu-like symptoms. Our 17 stations are still closed to the public for general access, as is the administration building. If you need anything from the fire district other than emergency response, you can access through our website, www.slcfd.org. We are operating at a normal status with respect to staffing. We monitor each day our call volume. We have seen somewhat of an increase, but not so much as to impact our operations. We've had multiple public vendors get with us for donations, which have been phenomenal, in anticipation of what our needs may be in the next few weeks, and that has been very helpful. If you do call 911 and you need our services, please be forthright. If you or anyone in your home has experienced flu-like symptoms, that will not delay our response, but it'll get us better prepared when we get there on scene. If you see us arriving, even if it's a non-flu related call, expect to see our crews wearing eye protection, a mask, and gloves. We went to that as a standard protocol yesterday on all medical related calls. So don't be surprised if you see it. It's as much for your protection as it is for our personnel. Again, I'm going to emphasize what everybody else has today. Social distancing, regular hand washing, hand sanitizers will get you from one sink to the other. In other words, if you're out and about, that's what a hand sanitizer is for. Before you leave the house, wash your hands. When you get back in the house, wash your hands again. That's the best advice I've gotten, and we've been giving that to our own employees. When they come back from a call, they're instructed they go right to a sink and clean up, even if they've already cleaned up from the hospital. So I encourage you, please, to use the same protocol at home. Be safe, and we're going to get through this.
Thank you, Chief, and to the first responders that are out there as well. Again, our gratitude and thanks for the way they put themselves on the lines for us. Up next, I'd like to introduce Kathy Townsend, who is the chair of the St. Lucie County Commission.
Thank you. Thank you all for being here. I appreciate everybody's effort in making this be the success that we've had so far. So I just want to start off with some brief notes that I've taken, and I just want to say that integrity is doing the right thing when no one else is watching. And if everyone would be exemplifying their integrity, we, the government, would not be having to remove privileges. I do not want to take control of your world. None of us do. We're trying to make your world safer. It's time to disconnect and connect with your friends, families, and spouses and go out there and do what we did as children. Make cookies, get your Kool-Aid pops, slip and slides, take out the Bisqueen from the garage and put some dish soap on it and create the fun and create the memories that we all had growing up. To those of you that have bought the 25 jars of soap and hand sanitizers, other people have to wash their hands too, and that's how we stop spreading the virus. So if you were one of those that went out and bought 10 jars, please take one to a neighbor or somebody that you know is in need of needing a jar, because it's important that we all have the necessities to be able to wash our hands to stop the virus. Many of you have been laid off, and we want you to understand that there's going to be financial aid available to you, and that the governor is following the protocol so that those financial situations will be handled once this is over with, and the funds will be made available through the county. And I want to say thank you to the nurses and healthcare professionals that are out there right now, because you were truly on the front line right now, and you are being exposed more than anybody. And so many times you go unnoticed for your hero efforts that you do, and it's important that when you see a nurse, when this is over, to be mindful of what they've walked through for you. Also, I think it's important because so many families are staying home right now. You're finally getting to see what a teacher lives every day at school with your child and your loved one. And so if you do nothing else during this time of being home, I want you to take a piece of scrap paper or an old card. I want you to draw on it. I want you to have your child sign it, because when we get back to our daily life, it's going to be an even more amazing one, and we're going to have simpler things. And I want you to take that card to school, and I want you to tell your teacher that you see her worth at the beginning of a new beginning, because what she really does every day for your child. So again, please follow the rules, follow the recommendations. We do not want to close boat ramps. We do not want to have what happened last weekend. We want you to have this time with your family. Go out in the boat, abide by the things that Sheriff Mascara has said. Please follow our orders. We want you to have a life. We want you to be safe, and we don't want to spread this germ. Truly, right now, what's going on is a gift. So embrace this time, and thank you.
Thank you, Madam Chair. Next, I'd like to bring up Commissioner Sadowski, who's the Vice Chair of the St. Lucie County Commission. It's not all bad news out there. We've got some good news to share as well.
Good afternoon. I'm glad to be the one to be able to share some good news today. As we know, we've been through a lot of hurricanes, and through crisis comes collaboration, cooperation, and generosity in the face of challenges. St. Lucie County has been recognized as a good government, forward-thinking agency, and I had the chance meeting of Carrie Mortgage of the Mortgage Family Foundation. She recognizes what we have been able to accomplish with our relationships with the United Way, Allegheny Franciscan Ministries, a number of nonprofits, the Roundtable of St. Lucie, and many others. As part of this process, the COVID-19 issue, we're seeing a challenge of childcare for many of our first responders, our frontline employees, medical, firefighter, paramedic, law enforcement, the emergency rooms. You're hearing that story. So the Boys and Girls Clubs of St. Lucie County has implemented through and cooperation with our HR department in St. Lucie County to provide childcare for these individuals. There's a registration process to go through, but I'll share with you that the Mortgage Family Foundation has seen the value in what we're trying to accomplish, and they have gifted this program $100,000. To that, we are very, very grateful. With that gift, we're also challenged to try and find additional contributions, matching funds. If you're a business that recognizes our first responders, our law enforcement, our medical personnel, $35 a day is what it's costing right now to provide that child care. If you'd like to donate, contact the Boys and Girls Clubs of St. Lucie County. We will gladly place that money in a process so that those funds can be used to continue to provide those services. With that, I'd like to thank again the Mortgage Family Foundation, and as part of it, together we will get through this together. And thank you for your contributions and your assistance in helping match this grant. Thank you very much.
Thank you very much, Commissioner. That concludes the speakers that we had for today. I know that we still have our medical team here. We're happy to answer any questions that there might be. Just hold on. What we're going to do is get the microphone so that we can hear everybody.
Yes, please. Thank you. Regarding the person who died from COVID-19, can you tell us anything about the age, gender, and also can you tell us about anything about the severity of the other cases, please? Thank you.
So it was a 59-year-old gentleman, and he was a resident of St. Lucie County. The other individuals who do have COVID, we are in constant communication with them.
Was he the, can you say whether or not he was the first case that was diagnosed in St. Lucie County?
I don't have that. It's an ongoing investigation, but what I could tell you is he was a resident of the county.
Can you just say a little bit more of what you mean when you're in daily communication with these people? Is that a phone call? Is that a house check?
That's a great question, Megan. So as we now have 12 cases, what we are doing is it starts out by our protocol that we would be in touch with them when we first learn about the case through our laboratory. So we initially have to make contact with them. So it's always a phone call. And then we learn a little bit more about who they've been in contact with for the past 14 days. So from there, we need to stay in contact with them, whether we are doing it, it initially starts out daily, but as we tend to get more cases, and it might have to change as far as our priorities of doing it, but we definitely reach them daily. We have been speaking to them daily, and at this point, it has not been an issue. You know, one thing that we've been doing from the health department that I have is we doubled our capacity for our disease investigation group. So we've been working on that, and we'll continue to build surge. Because as I mentioned before, contact investigation and contain the virus is number one. So it's absolutely critical that we stay in touch.
Hi. So yesterday, according to the statistics, there was no one hospitalized and there was no one dead. And so today, someone passed from this case. Did he go to? Was he hospitalized today, or did he pass at home?
So we really do not speak about specific cases with in that instance. And again, at this stage, what I would say is he was a resident, and our sympathies go out to his family and friends.
Are you able to say if he traveled or did he contract the virus locally?
I'm not sure at this point. It is ongoing, the investigation. So I really don't have those facts right now.
This is a question for Cleveland Clinic President. We had a former and a current employee at Cleveland Clinic Hospital tell us that they're being told by management that masks and other protective gear is specific for doctors and some nurses, and they're very concerned about this. So I just wanted your thoughts on it.
Okay, first of all, our usage of protective equipment is aligned with CDC guidelines and what's come out of the Florida Department of Health. We are trying to make sure that any caregiver that comes in contact with a known or suspected case has access to all of the appropriate items. I know that we have some caregivers that would like to wear that equipment at all times in all locations. But as I'm sure all of us have seen now in the media, the supply of those items is such that if we were to be very liberal with the use here, we're going to run the risk as a society, not just our organization, but across the country, of not having access to that as this ramps up, as is projected. But under all circumstances, we are trying to protect our caregivers and other visitors and patients by giving them protective equipment anytime they're in an area where we think that there may be an exposure. And we address that on a case-by-case basis with individual caregivers. We've had some that have been uncomfortable with that, and I know that our human resources people are working with them to hopefully get them comfortable or get them assigned to a place where they're more comfortable.
And Mr. Lord, while you're still up there, do you have any update on, obviously everyone's still talking about testing accessibility and the time it's taking to get tests back. Is the test time for getting the tests back still increasing? Are you noticing that leveling out, or is it starting to speed up a little bit?
It seems to be leveling out. We've cleared some of the backlog that we have. For those members of the community that don't know this, what we do is we take a sample from a patient, and then it is shipped generally to a commercial laboratory, but it can also go to the Florida Department of Health, where that test is then processed, and then they send the results back to us, and a physician contacts the patient. It is in the laboratory setting where we've had the challenge. It is my understanding that those laboratories are working around the clock to increase their capacity. We have seen some improvement, but we still have some test results that we've been waiting for 7 days for, and that's longer than we would like. But we're doing everything we can to increase that, or to improve that, and hopefully we're going to be able to get some testing supplies here where we could do that ourselves. But I understand that the demands in other areas, particularly New York City, have caused some of those supplies to be diverted elsewhere.
Are you able to say how many tests? I know you said you've processed, over 600 or 800 tests. Do you know how many are still waiting to get back?
I do have that information. We've tested just over 1,000 patients, and results to date, total tests, including on the inpatient and the drive-through and through physicians' offices, is right at 1,400 tests. We have close to 1,000 we're still waiting on test results for.